The South African government insists it will not impose restrictions on travellers from China as COVID-19 infections in that country continue to surge. Infections in China have hit new records and hospitals and crematoria across the country are reported to be overflowing. China recently dropped its COVID-19 restrictions, which reports indicate that the drop has led to an increase in new infections in the country. Countries such as France, Spain, South Korea, Israel, the United States, Japan, India, Malaysia and Taiwan have all imposed travel restrictions on travellers from China. To help us unpack the South African government's stance on these latest developments, we are joined via Zoom by Dr. Nicholas Crisp, the Deputy Director General of the NHI in the National Department of Health. Dr. Crisp, a very good morning. Thank you so much for joining us. Welcome to Morning Live.
Morning, Simpiwe, and morning to the viewers.
Now, what information are you receiving from the World Health Organization regarding the COVID-19 numbers coming from China?
Well, thanks very much. So we all know, and it's in the general media, it's widely available, that there are a large number of cases being reported out of China. But as we've all learned over the period of COVID, it very much depends on what the variants are and how those variants are behaving. And it's quite area specific depending on how much immunity there is in the community and how much impact the vaccines have had, and a whole range of other factors around how we've managed in various countries to control our own pandemic. So the variants that are being reported out of China is a variant of Omicron, and we have had Omicron for a long time in South Africa, as you're aware. And there are many variants or lineages of that variant that are in circulation in the world, could be as many as 150. And most of them just behave in the same way as the original Omicron, which does not give it's high transmissibility, but not very severe illness. So our population is well exposed to Omicron. We have a very high level of immunity, and the cross immunity is good. So we believe that we are reasonably well covered, even with the vaccination coverage disappointingly low. However, China is a huge population. We know that there are well over 1 billion people in China. So the numbers that we hear coming out of China are frightening to us. I guess that is why people are panicking. At the moment, we are monitoring with the best information we can get. There are some reports coming from WHO and from China, and we will be meeting regularly, probably daily from now on, to make sure that we understand whether there is indeed a risk that we should be reacting to.
Dr. Crisp, you just conceded to the fact that the infection numbers in China are very frightening, but the country has lifted, the restrictions from travellers from China. So what's the country's stance then on this matter, and what discussions are taking place as government?
Yeah, you see, so the challenge is that when you see numbers, if you have a large number of people, we have 60 million population, they've got over 1 billion population. So their numbers sound frightening to us. They're huge compared with what we would have here. And a part of it is because their vaccination coverage is low, and they have not been exposed because they've been in constant lockdowns for a long period of time. So they are getting that exposure that we've had over the past year and more. So there aren't that many travelers that come from China, but obviously the risk is high that some people who are traveling will be traveling with COVID infections. As I've mentioned, the infections they're likely to come with, at this stage we know that the variants that they are exposed to are variants we've already been exposed to in South Africa. So one must be very cautious. Remember what other countries did to us, locking down borders prematurely, when they already had the virus in their own countries. We must be very cautious of overreacting. We are not the only country. There are many countries who are saying this is not the route to go. And we will, as I said, be meeting daily to establish exactly what the picture is, and before we make any decisions on how we're going to react.
So from what I'm gathering from your statement is that the country does not want to be seen to be overreacting. So what then would inform the government to change its stance on the matter? Could it possibly be an uptick in COVID-19 figures here in South Africa for the government to change its stance?
So there are a number of factors we watch. We watch obviously the number of cases, the severity of cases, the admissions numbers of patients with severe illness that are being admitted into hospital. If there are any changes in those figures, then obviously we change our strategy as well. But we are particularly interested in what are the variants. And obviously we are hoping that the Chinese government will make that information available to the world as quickly as possible, so that if there is a change in the variants and what they are detecting is different from what we've had, we may need to react in a different way. But for now, because we know what the variants are, or we believe we know what the variants are, and what is being reported from elsewhere in the world with positivity tests of people coming from China, we already have that exposure, and we have already had those variants circulating in our population for some time. So there would not really be a purpose for us to lock out people who have the same infections that we have already had for a long time.
Does it make it even more difficult, Dr. Crisp, to keep an eye on the situation, given the fact that there is no data coming from China?
Yeah, that is the biggest concern. So as I said, we would urge the Chinese government to keep the world informed. There are obviously mechanisms where we interact with other countries. We are part of BRICS, we're part of the WHO family, and there are other bilateral relations that we have across countries. So we would hope that we are warned, all of us globally are warned early, should there be any changes in the variants that are causing their problems in China.
And according to last week's reports, almost half of the 212 passengers who arrived at Milan airport from China tested positive for COVID-19. So what measures then do we have in place should we be faced with a similar situation?
Well, I think we have been faced with similar situations before, not necessarily with aeroplanes, but all over our own population, where high numbers, high proportions of people got Omicron infection in a very short space of time. But fortunately, Omicron, although it was highly transmissible and many of us felt lousy for a few days, did not turn out to be as aggressive, and there was already a substantial immune response within the community, partly because of vaccination and partly because of previous exposure to the other wild virus variants. So it's all about how much immunity we have. And many of us have been sick and been infected and not been sick even, or been extremely mildly sick from the variant. So just testing people positive is not the only indicator that we would be concerned about.
Let's now shift focus, Dr. Crisp, to the National Health Insurance. How far is that process, and what can we expect in 2023?
We're expecting an exciting year this year. Parliament got almost to the point of the vote. So there's one more step to go through Parliament. The Department of Health has been given an opportunity to respond to all the comments on the 30th of November. And the remaining process is for the Chief State Law Advisors to synthesize the suggested changes to the bill and present those to Parliament, to the Portfolio Committee. And then it goes to a vote, after which it will go to the National Council of Provinces. So we are sincerely hoping that the bill goes to the vote and becomes law during the course of 2023. There's obviously a huge amount of preparatory work that is going on behind the scenes, and it will take a long time of rollout to implement the many stages and steps that are required. Changes in budgets, changes in the preparation of regulations and so forth. So I think you're aware we advertised 44 posts for key positions. We have shortlisted for all of those posts and interviewed for some of them, and we're hoping to make appointments. In fact, the first one or two are already being processed when we broke for Christmas. So early in the new year, we'll start to make appointments and start consolidating the work we've been doing.
And when should we expect the consultations then at the provincial level to begin?
Well, there's already been consultation from the NCOP, from the National Assembly, but the NCOP's consultations, as I understand it, is that the bill from the National Assembly goes to the provincial legislatures. The legislatures must then decide how they wish to conduct their consultation processes in the province. So in the first 6 months of this year, we anticipate that that's what will happen.
What are some of the biggest challenges facing the department in relation to the NHI and its implementation?
The biggest challenge is if we don't implement it, our health system is going to implode. And the reason for that is because the costs of our health system and the two-tier system that we have are creating massive divergence in our ability to look after people in the country. We spend 5,200 Rand per capita on the public sector patients and over 26,000 Rand per capita per annum on private patients. And what happens is that the resources are drawn into looking after a smaller and smaller proportion of the population. And we need to use all those resources collectively, reduce the duplication in the system, and make sure that we reduce the administrative overheads of running 9 different provincial departments and 76 medical schemes, all of which create an additional administrative burden and do not contribute to improved healthcare. That's the biggest challenge. From an implementation perspective, there will be resistance from a number of quarters, which people have already indicated, and we will have to deal with them on a case-by-case basis as we understand where people are concerned and what it is they're not understanding about what we are trying to achieve.
So how will this be funded then? Should we expect a surcharge on the personal income tax?
Okay, so the current funding of our health services is around 577 billion Rand a year. Last year, that's the estimated expenditure. About half of that, 49% of that, is currently spent through our taxes, which go through Parliament in appropriation to the national and the provincial departments. That money, the bulk of that money, will be redirected into the National Health Insurance Fund, but obviously not all of it, since there are some functions, health functions, which will not be managed by the National Health Insurance. Of the remaining money, the roundabout 260 billion that is in the private sector, some of that, 34 billion, is tax credits that are given to members of medical schemes, and we would like to see those tax credits redirected into the fund. There are amounts that are in other government departments and in other funds like the Road Accident Fund, which need to be channeled through the National Health Insurance. And there are a huge number of medical scheme members who are public servants whose at least half of their medical aid contributions are paid for by the state. Over time, one would want to see the state's contributions channeled into the fund rather than into medical schemes. And then finally, down the line, we would, once the benefits are defined and being provided through the fund, we will see a change in taxation, and the money that we currently pay, those of us who contribute to medical schemes, that we currently pay to medical schemes will be raised in taxes instead of voluntary contributions through medical schemes. That's a couple of years down the road still.
Dr. Crisp, you'll recall that the past versions of the draft NHI have been heavily criticized because of a myriad of inaccuracies for projected costs. So has the National Treasury then come up with costings? Do we know at this point how much the NHI will cost?
So yes, we do. We've been very clear from day one, and we have followed exactly what we have discussed with the World Health Organization and a number of other countries who have advised us very clearly, do not even attempt to cost what you are doing. It's a pie in the sky to try and estimate what will happen 5, 10, and 15 years down the road. Mm-hmm. What you do is you fix your envelope and you work within your envelope. So our current envelope is 8.5% of GDP. And what we need to do is make sure that we spend that 8.5% of GDP wisely. At the moment, we do not spend it wisely. We duplicate laboratory tests, we duplicate x-rays, we duplicate investigations. And I personally try to work out how many files I've got at different doctors, dentists, and hospitals that I've accumulated in my life around South Africa. And it's frightening, because when you get past the 30 to 40 mark, you wonder, where are all your records? So if we have no idea what we are doing with patients and to patients and what it's costing us, we are wasting a huge amount of money. So the point of the exercise is not to try and add 1 Rand plus 1 Rand plus 1 Rand and see how much is spent on a particular intervention over a period of time. But to say how much money are we prepared to invest as a nation, how much do we spend on a year-to-year basis, and how can we spend that money far more wisely and equitably to achieve better outcomes for the entire population. That's the route that we are going.
And another route perhaps would be re-evaluating how much the country needs to invest in overhauling the entire health system, in particular the public health system, which is absolutely diabolical at this point. And I'm sure you will agree with me, Dr. Chris, but implementing and applying the NHI under the current climate of the health system is like, applying a piece of Band-Aid over a gaping wound.
Well, I think we will have to disagree on that, Simpiwe. The challenge is not just the public health system. Everybody's focusing on it because that's where the pressure is at the moment. I've just mentioned we spend 5,200 Rand per capita in the public system and over 26,000 per capita per annum in the private system. What we need to do is to have more patients who are currently dependent on the public sector being seen by those highly capable and competent private providers and paid for from the fund. Then we can reduce the pressure on the public sector so that we can fix some of the challenges that are going on. There has been underinvestment in infrastructure over a long period of time because there just hasn't been the budget for it. There is underinvestment on human resources because the budgets are being reduced over time and not increased, and the unit cost of human resources is increasing as salaries improve. So there are indeed many challenges. But it's not about just fixing the public sector. There are many problems in the private sector as well. We saw in the health market inquiry reports severe overservicing in the sector, competition problems within the sector, and many patients who find ways to defraud and deflect payments within the private sector as well. So we cannot focus just on the public sector, although that is obviously a challenge for us right now. We do need to improve management. We do need to do away with as many of the fraud and corruption cases as we are seeing in the media space. But don't for a minute believe that there aren't massive challenges in the private sector that need to be addressed at the same time. We need to sit down as South Africans and confront our future and make sure that we get as much healthcare as possible for the money that we are spending.
All right, Dr. Crisp, great chatting to you. Thank you so much for joining us this morning. Thank you. That was the Deputy Director General of the NHI in the National Department of Health, Dr. Nicholas Crisp, helping us unpack several issues of the country's stance on travellers from China as COVID-19 cases in that country continue to surge.